Okay, so we're going to look at a couple of differences here in the bovine when it comes to arterial pattern. So again, we see here we're coming rostrally, or cranially technically, up the common carotid artery. Again, now we're looking into the area right around the pharynx, and we can see this artery coming off the common carotid and going caudally towards the area of the occipital condyles. That is the occipital artery, and we see that there is latex because it's still patent. However, right next to it is a soft tissue structure that has no latex but is originating right at the base of where the occipital artery is coming off. This is the remnant of the internal or extracranial segment of the internal carotid artery in the bovine. Again, it is not patent, so there's no blood flow within the internal carotid artery. It's also within this area that we will see an artery branching off kind of the cranial aspect of the external carotid, and we see a bunch of little branches going into the area of the pharynx. So that is the ascending pharyngeal artery in the bovine. Aside from that, about the only differences we're going to see include some of the facial arteries. So in the bovine, a lot of times we will see maybe, or have the possibility of seeing two inferior labial arteries. But then we also have the superior labial artery. But then we're going to see this one little artery come off and kind of supply the area of those facial or mimetic muscles. So this little artery right here coming off essentially what would be the branching of the facial into the superior labial. And finally, that artery is the rostral lateral nasal artery. And you're going to see it covering these muscles of facial expression right here. Let's come over and we'll look at a couple of these off the external carotid. So just for orientation purposes, we have the external carotid artery, we have the caudal auricular, and the superficial temporal. Now the branches of the superficial temporal, again, are going to include the rostral auricular towards the rostral side of the auricle, a transverse facial across the masseter, but the one that we will have, which I don't really see that well dissected in this specimen, would be an artery that would be running along the temporal line towards the horn, and that would be the cornual artery. Okay, coming back, now that that superficial temporal artery has come off, we now have the maxillary artery. We have that inferior alveolar artery right there that's cut, same as inferior alveolar nerve. We have this artery right here, which is the caudal deep temporal artery. We have the buccal artery coming down towards the cheek, and can't really see the external ophthalmic. He's way up inside there going up into that periorbita. But from here, the branching's pretty similar, but usually it's a little easier to find an artery right here running up through the ventral aspect of the orbit. We can see that artery right here. And if it's an artery running up the ventral aspect of the orbit, that's going to be the malar artery. So if you see an artery just ventral to the orbit and all of its contents, that's the malar artery, which is a branch of the infraorbital artery.